It is a fact that life is limited. There is a certain lifespan around which human life evolves. The average lifespan of human is around 72 years. After that, human body and its organs start to decline in function and efficacy as they were at a young age. Our heart also undergoes this demise with the increase in age. Today, we will learn a little about heart failure and the drugs related to its management. But the question should be, what is heart failure? Heart failure, known as HF, is a complex, progressive disorder in which the heart is unable to pump sufficient blood to meet the needs of the body. It affects 1 to 2% of those aged more than 65 years and 10% of those aged more than 75 years. The prognosis is poor. In severe heart failure, more than 50% die within 3 years. Sudden death is a common mode of death in heart failure. Its cardinal symptoms are dyspnea, fatigue, and fluid retention. Heart failure is due to an impaired ability of the heart to adequately fill with blood and to eject blood. Let us learn about preload and afterload. Consider an example of a beaker connected with 2 pipes. One pipe lets the fluid enter in the beaker and is called ability of preload. Other pipe determines the threshold to which a beaker can be filled up to a certain level and is called afterload. Heart failure is often accompanied by abnormal increases in blood volume and interstitial fluid. Underlying causes of HF include arteriosclerotic heart disease, myocardial infarction, hypertensive heart disease, valvular heart disease, dilated cardiomyopathy, and congenital heart disease. Classification of heart failure drugs is done on several bases. Let us learn about them briefly as well. Anatomical bases include left heart failure (LHF), in which the left side of the heart is usually affected. First, poor ventricular contraction causes blood to back up into the lungs. It is known as pulmonary edema. Right heart failure (RHF) is an increase in the pressure of the pulmonary vasculature, causes the right side of the heart to pump against increased resistance. The right heart compensates this with ventricular hypertrophy. Pathological bases include 2 criteria. Functional, including systolic heart failure, which is known as heart failure with reduced ejection fraction or HFrEF. Impaired left ventricular systolic function is a key feature. Diastolic heart failure, that is also known as heart failure with preserved ejection fraction HFpEF. These patients have preserved left ventricle systolic function. In low-output heart failure, compensatory mechanisms eventually fail, resulting in reduced cardiac output. High-output heart failure is inability of the heart to meet increased metabolic demands of body tissues despite normal or increased cardiac output. Temporal bases include acute heart failure, which is a medical emergency. This may occur in the context of an episode of decompensation of chronic heart failure, which is termed acute on chronic heart failure. In chronic heart failure, the term heart failure, when used in clinical practice, is often synonymous with patients who present with the chronic form of this condition. Now that we have gone through heart failure brief intro, let us investigate its pathophysiology and relate that with its treatment.